The following Best of Central Florida program is sponsored in part by these fine sponsors.
Welcome to the Best of Central Florida, joined as always by my beautiful co-host, Makaila Nichols. How are you today?
Great.
Wellness is important to us, physical and mental, of course. I almost cry coming. I mean, I share some personal stuff here in a minute as we talk about mental well-being. Do I not?
You do.
You'll have to stick around. Best of Central Florida continues.
The Best of Central Florida is sponsored in part by these fine sponsors.
Welcome back. Here we are in Maitland, a town I know very well. I spend like 3/4 of my life in Maitland, I feel like.
You basically live in Maitland.
I do, and my office is right down the street, but I need to spend more time here, obviously. We're at Stokes Counseling and Consulting. You know so much more about therapy than I do.
Well, I'm not a therapist, but I do.
I'm saying you've been to, I'm not trying to like talk smack or anything, but you've been to a lot of therapy.
You know what? I'm so happy you brought up that you talk smack about going to therapy. I think everyone should go to therapy.
I do too.
Hear from two experts, two awesome therapists about why that's a real thing.
And I can't wait to do so. Here, joined by Dr. Jeremiah Stokes, the man who started it all, and Jessica Richardson. Welcome to the show, guys. How are you?
Great. Thanks for having us.
Doc, let me start with you,
Yes.
because Makaila and I are a little bit different. She has spent a lot of time in therapy. I truly haven't. And for me, it comes down to finding time and carving out time in my day to go get therapy. I mean, how important do you think therapy is to people?
It's critical. I think that we have to look at our mental health a lot like we look at our physical health. And I think nowadays people are a lot more accustomed to seeking out mental health care than they used to be in the past. But I try to look at mental health as a way to optimize our life and our overall well-being. And so for me personally, it's a critical component of my life. And when I work with my patients, I try to really help them encourage them to understand that mental health care is really going to optimize every area of their life. Their relationships, the way they think about things, managing their feelings, their vocational lives, every component of life.
Yeah, Jessica, when you talk to people, they say, you know what, I'm going to carve out an hour in the morning to go to the gym, run on the treadmill. You don't always hear people say, I'm going to carve out an hour of my week to go seek therapy, but the therapy can be such a huge component of their overall health.
Yeah, it's almost like a reset, right? Throughout your day that you get time scheduled just for you to like talk about whatever it is that's on your mind or what you might be dealing with that week. I think a lot of our clients would also be surprised to know that as a therapist, I have my own therapy. So it's so important that I also have that time for myself too.
Yeah,
what kind of patients do you see over at Stokes? I mean, how young, how old, what does that look like?
We are a comprehensive mental health facility, so we work with the entire family system. We have patients as young as 3 years old. We work with teens and adolescents. We obviously work with individual adults, couples, families. I do forensic work myself, so I work in high conflict divorce. So I mean, we really do it all. We also provide psychological testing. So we provide educational testing for kids who need 504 IEP academic accommodations, personality testing, forensic testing. So we really see it all.
There's a comfortability factor, I think, as well, when someone is really trusting you with their mental well-being. I felt immediately comfortable when I walked here. We're upstairs right now, the downstairs super comfortable as well. How important is it to you that your patients, the people that trust you, feel comfortable when they walk in here?
Comfort is everything, you know, and there's different ways to measure comfort. It's the environmental comfort. So I think as therapists, we're very mindful of how our offices are set up, right? Because the minute that a patient walks into the office, they're actually engaging in a therapeutic experience. And then obviously when we sit down with them, we're trained interpersonally to promote comfort. If a patient doesn't have a sense of safety and comfort, treatment's not going to be successful.
As soon as we walked in, you were talking about your team. I can tell that you're proud of your team here. What really separates the team here at Stokes from other places?
We're so dynamic. We're so eclectic. You know, we have a multitude of team members who are trained in a bunch of different modalities. Again, we have therapists who are trained in working with children. but people who are really driven and committed to the field. But as Jessica noted earlier, people who are driven and committed to taking care of their own mental health. And I think that speaks volumes. You know, patients can feel it when we take care of ourselves. And so my team really, I think, exemplifies that.
Yeah, and I've gone through something personally over the last 4 years that she knows much about, obviously. I've never really talked about it in this show, but there was a breakup. I have 2 daughters, and the oldest daughter, who's 13, still is really having trouble even liking me. You know what I mean? The 7-year-old perfectly fine. Yeah. 13-year-old just doesn't like dad, and it's the weirdest, strangest thing. It's like I'm looking at, it's like I'm watching a horror movie almost, and it's actually my life. I can't believe it's happening to me. What does someone do in that situation? What can you do?
That's incredibly painful, and I think it's a very complex situation. You know, when we look at divorce, there's a lot of factors that the child is exposed to. I mean, their home life essentially gets dismantled, right? And so when you have a child who's maybe adverse to one parent, it doesn't necessarily mean that that parent did anything. It's just the fact that divorce can be very traumatizing and distressing, and so sometimes a child will cope by detaching from one or both parents.
Yeah, it's tough. Jessica, let me talk to you for a second. So a lot of people out there have been to therapy before, but I think there's a lot of people out there who have not been to therapy. Let's talk to that person who knows they're not feeling perfect, but they also haven't really ever dipped their toes in that therapy water. What would you tell that person about, look, this isn't a scary place, this is a happy place? What would you tell the person who's never been to therapy?
I would tell that person that it is really brave of them to want to seek help and to come in, but at the same time, I think we need to crush that stigma around getting help. I think there's a lot of times where people maybe hold back even though they know it's probably in their best interest. And I just want to reassure them that there's always going to be someone that's caring and compassionate, that it's going to meet them where they're at in their journey.
How many times? Go ahead.
No, I think the testing is so important, especially for parents watching at home.
Yes.
You know, maybe you notice your child's struggling. I mean, for me it was math or things like that. When do I call you? When do I bring my child in? Mm-hmm.
I think there's different metrics. I think first of all, is your child experiencing stress when they're engaging in academic work, or is there behavioral disturbances in their life? Are they having difficulty managing their emotions? So I think we have certain metrics. One is their academic performance. One is their ability to manage their emotions. The other is how difficult it is to parent the child. And a lot of times it's very elusive with what could be going on with the child psychologically. So when they engage in formal psychological testing, we're able to categorize what's happening.
I think it's important what you do here and what you've created, Doc, is that some therapists, they really focus on just one thing, or almost just men, or just adults. I don't want to say full service, but don't you think you've created something special here where it really is for almost everyone?
I have to say it is, and that's been my mission and vision since I started my group practice, was really to provide an organization that serves all. You know, I would consider us a community-centric, family-centered counseling center. I mean, that's our motto.
You're doing a great job. I really hope that you guys will call them, because I think it's so important. I really do. And I know I need to get more involved in therapy, but what a great place.
It sure is.
It is. Keep up the great work.
Thank you so much.
Thank you for having us.
Absolutely.
So nice to meet you.
Thank you.
Look, the phone number's on the screen. Even if you have a therapist, maybe you're not feeling comfortable, you want a different approach to what you're doing, or if you're like me and you haven't really been to therapy very much, I highly recommend the team here at Stokes. You will be doing yourself a favor, I assure you. Stick around. Best of Central Florida continues.
The Best of Central Florida is sponsored in part by these fine sponsors.
We're continuing our Best Wellness episode here on Best of Central Florida with a place I come to all the time. I am joined by an amazing doctor, amazing friend, amazing woman, Dr. Zaidi. Number one, thank you for the incredible work you do for me. I'm kid you not, guys, I spend so much time here because I trust Dr. Zaidi at Belle Ame Wellness. Why did you want to start Belle Ame Wellness? I know you've been on the show before, but I think people need a recap as to why.
This has been on my mind from quite some time, and I love my family medicine, practicing medicine, talking to the patients, but I just wanted to work with equipments and machines, and then this way also we can do some changes in patients' lives, people's lives.
And it's literally like you can come here for family care, but also you have like the aesthetic side where you can come and do so many things. Like I said, I'm here a lot. You know, when you were on the show in the past, you had some amazing treatments, but now you have some new procedures. Tell me a little bit about those.
So we keep on adding new things as we keep on getting the competency in one service or something, and we want to progress, because it's not fun to be just stationary, so we like to progress.
You gotta change it up.
So we have added microchanneling, which is a very simple procedure, which is a little upgrade of the microneedling. Okay. And our amazing esthetician, she's awesome in doing that. It really helps. It penetrates a little bit better. It improves the skin texture a lot. And it's very good for fine lines, pigments, because we are able to use different kinds of serums along with that.
You know, you take such beautiful photos, have so many like awesome, just kind of like promotional material, but sometimes you use really pretty people to do so. Why do you do that?
Well, you are one of them. Well, I cannot be like patient privacy because you are there all over. Yeah. And it's so funny because a lot of people have said, why she's just so young and getting it done. So a lot of people don't realize that these things are not just a treatment to treat wrinkles or pigments, but it's also preventative. She's trying to build up the collagen, which is due to the exposure to the lights, the sun. At least you are doing it preemptively. So you don't want to develop the wrinkles to get them treated.
I don't want any wrinkles.
So it's a very good way of building up the collagen, and you prevent things from the damage.
Yeah, I know. Even literally I've come in here before and she's like, your skin's you're out in the sun a little too much, Makaila. But you really, and I think that's so awesome, because some people would just fire up the laser and be like, all right, let's do it. But not you. You really, I mean, you're a doctor first and you care about your patients. And I think that just goes to show that it's not just a place where you can come for aesthetic services. You can come here, she's a full-fledged doctor, but you really have your patient's heart at the core of who you are.
It's really a blessing. I really feel honored and blessed that I'm able to take care of my patients who trust me. Yeah. And that's why a lot of my patients from the clinic side, medicine side, they come over here, because if you're doing it, and they have developed trust on my other staff members also who perform the procedures. So just like you said, that today there was a patient who had come from a little bit far for some laser treatment, but I noticed some stuff on her lips, and I said, no, this is not right. I'm sorry, I cannot treat you today. So I had to prescribe her medication to take care of that. And then I said, okay, come back in 2 days. She was a little bit disappointed, but I said, hey, it's for your safety.
It's health. Yeah, it's for safety. You know, talking about health and safety, you focus a lot here on weight loss as well. Mm-hmm. Why is the focus on weight loss?
So we had an endocrinologist also who came to our office, and the main thing is that obesity has been diagnosed as a disease. It's not a social thing, and to wear the clothes better or stuff like that, looking better, looking good in the mirror. It's actually health. It's a disease which encompasses so many other diseases. I had a patient today, in fact, just today, she has lost about 25 pounds. Wow. She has stopped taking her blood pressure medicines, and she looks fabulous. So amazing. It's a lot of disease components which are linked to the obesity. A body increases in size, insulin is depleted, people become diabetic, blood pressure goes up, hormonal disbalances also happen. So fat in the body, not in the right amount, is a toxic factory.
Talking about fat, what is visceral fat? I don't even know if I said that right.
No, visceral fat. You're right. So we have fat all over the body, but there is some fatty tissue. There is a fatty tissue which deposits inside around the internal organs.
Well, that doesn't sound good.
Yeah, so it's not very good, and it's more dangerous than the fat which is outside. Of course, it's not very appealing to have fat outside. It gives overall the increased weight. But the visceral fat is really what we are trying to target. And once that starts to go down, the belly shrinks in size, and overall health and numbers get better.
Wow, talking about other numbers, hormones and HRT, what is that, and do you do that here?
We have recently added this service. As we got the training, we had to go to Tampa to get the training. It's hormone replacement therapy. There was a lot of stigma around the hormone treatment because there was a paper which was published about 20 years ago, and then everybody stopped using it. But now it's coming back, and there are so many beneficial things associated with that. It's not only for women, but it's also for men. When people think about men, they only think about testosterone and sexual dysfunction, but it's not just like that. Yeah. Men also need estrogen. Women also need testosterone in the right quantity and right amount.
I want too much.
Yeah. So it keeps a overall balance of the emotions, the bone density, the muscle mass. A lot of people are losing weight, so they lose a lot of muscle mass as well. So these hormones, especially testosterone, helps in maintaining the muscle mass and maintains the bone density.
Wow, so many things. And that's another thing that I love about Dr. Zaidi is she knows all the things, number one, but really you can kind of work on a custom plan per patient. So, I can be seeing you as a doctor, and then you could be like, hey, Makaila, like XYZ, and really just like hear about my goals and all that kind of stuff. I mean, for me personally, I've been coming here for laser hair removal. I've been doing the laser genesis. Like, we're gonna be doing Japanese head spa. We're gonna do that here in a moment.
That's one of the newer things.
I saw this on TikTok a while ago, and I was totally impressed. When I saw that you had it, I was like, oh my God, Dr. Zaidi has a Japanese head spa. What is that?
Japanese head spa, it utilizes old Japanese rituals about head massage and scalp treatment.
I'm getting excited.
Yes, especially with your busy lifestyle, you really need somewhere or someone to relax you, and Candice, our esthetician, is very expert in doing that. It involves multiple steps. Some people have commented, going for a head wash or shampoo, it's a lot more than that.
Yeah, I know. Literally, I was getting a little sneak preview, and we'll have some footage of this, of like there's a thing to look at your scalp.
Yes.
All of it.
It starts with the skin.
Should have washed my hair maybe a little better. I'm a little nervous.
So it starts with the scalp analysis. We have a device that we can check and how much is the flakiness, or if you have any propensity for hair loss or clog pouring that we call as.
So many things in your head you don't even know.
In your head, inside, outside.
Yeah, speaking inside, outside, what procedures have you had done here? I mean, do you trust your staff to really work on Dr. Zaidi?
I get almost everything done, which is applicable to my age, but I'm not going to give you all my secrets.
Yeah, don't give them all out.
Except some of the things which I do that, so nobody else is doing it, so I'm missing those. So I'm going to train my staff to do that on me. But most of the things, yes, I trust my staff, and you'll be surprised that a lot of things I try myself first.
Yeah, as you should. You gotta know what's up.
And so I can tell my patients, hey, I'm doing this and I'm doing that, and I've tried. They ask me, have you tried that, doctor? And I said, yes, I have. So I feel confident when I'm telling. And the effects, whatever the medications or treatments or procedures, at least I can guide them better. I'm going through myself.
Very true. Well, Dr. Zaidi, you are just an incredible person, and I know you really started this from inner beauty, and I didn't focus on that earlier. Belle Ame is really to focus on beauty radiating from the inside out, and you do that. I trust you. I love coming here.
Thank you so much.
Yeah, if you have any questions or you just want to come and hang out with Dr. Zaidi, maybe you don't know what treatment you want, just give her a call. Give Candice a call. Come hang out here over at Belle Ame Wellness. I know I'm going to go hang out and get a Japanese head spa and probably be here the rest of the day. We'll be right back with Best of Central Florida as this episode continues.
The Best of Central Florida is sponsored in part by these fine sponsors.
Dunamis Family Health. I am joined by Dr. Joe. Dr. Joe, talk to me about ProBalance.
So ProBalance is a new system. It's FDA cleared for treating vestibular neural pathway retraining. What that simply means is we work on balance and cognitive function simultaneously, offering you a streamlined treatment so you can get the maximum benefit in a short period of time.
What does this treatment look like?
So what we first do is an evaluation. We get grip strength, range of motion, metrics on your balance, two-legged, one-legged, with eyes open, eyes closed, and also do a dynamic weight shift, which is where you have to kind of follow a ball in a circle pattern by shifting your weight. A lot harder than it looks.
Sounds it.
But all of those data points go into creating a customized treatment plan.
Wow. Balance becomes dangerous later in life.
Oh yeah, definitely later in life, but also earlier in life now that we're seeing more people with sedentary lifestyles. So kids aren't out and active as much. Definitely something that can also be integrated into athletic programs. So balance is key for performance as well. So both for people who are in that aging category worried about falls and people who are looking for better performance.
Is this covered by insurance?
It is not, unfortunately, yet covered by insurance, but that's one of the reasons why I make my care affordable. We make it so that most people can afford the treatment, and it's way more affordable than waiting until you have a fall and an emergency room visit.
In fact, I went to your website before, and the prices are right there.
Yes, definitely. We're very transparent with everything. Normally, the evaluation is $150. Right now, if you click on the QR code and register for an appointment, I'll reach out to you, and we'll waive that $150 for a limited time.
Awesome.
Love it.
Thank you, Dr. Joe. If you're worried about your balance or you just want to find out how good it is, do yourself a favor and call Dr. Joe at Dunamis Family Health.
Welcome to our house. I mean, you spend more time here than I do, but it is hurricane season. You know our windows are terrible.
Yeah.
When hurricanes roll through, we actually go to your parents' house because we feel safer there because you don't feel the wind vibration. Go feel the windows right now. Hit the windows like that.
Okay.
This is not a window.
No,
that
and
it should
I mean,
ever
there's
be relied
condensation
upon
from just our sprinkler.
But during a storm like that, you
Water's
wonder why you
coming
feel the
through.
vibrations. Even when a summer storm rolls through, we feel the vibrations here. That's why Dan Brigman is here today, Renewal by Anderson. Dan, as a man, I want to feel like I have a safe, protected place for my family. And I don't here. I'm not ready for hurricane season because of the windows that we have. What can I do as a family guy to make sure my family's safe during the storm season?
Well, first thing you have to do is you got to do what, you've got to inspect your windows. You've got to know and learn about what you have. And you know, Justin, what you have is not a hurricane window. That's not going to stop anything from coming in this house. If a shingle or a terracotta tile were to blow off in your next door neighbor's house in a windstorm and hit that, and you're sitting at this table, it is not a good day. All right, it is coming through. So what we have to do is we have to get coastal windows in this house, and we have to get them in as soon as we can.
I totally agree. The financing that you have too is fantastic. You make it super easy for me to afford windows in my house.
Yes, we do. Look, we know that no home improvement project is cheap, right? I mean, most of us just don't carry, $50,000, $60,000, $70,000 around in our pocket, right? And so what you have to do is you have to make it affordable for our homeowners. And that's just what we do through our easy pay plans. We have multiple different ways that we do business. We have 12 months, no interest, 18 months, 24 months. We even have 180-month low interest plans. Some of them as low as 5.9. You can't even buy a house.
You can't. Not even close. Thank you, Dan, for coming, by the way. Do you feel better?
I do.
Are you going to stop yelling at me?
I mean, Dan's here, so Dan's going to save the day.
Thank
Our
you.
VA is always going to save
A
the day.
Renewal by Anderson, QR code on the screen right now. Get your family prepared for hurricane season and storm season. Even if the hurricane doesn't come through, the storm season gets scary here in Florida as well. Do it today.
The preceding Best of Central Florida program was sponsored in part by these fine sponsors.